Hello friends, welcome to my channel Neurology Videos Learn by Seeing. Today we will learn about another important topic, that is Conus medullaris, Cauda equina. What is the difference between Conus medullaris and Cauda equina? This topic is very important for all, for neurologists, neurosurgeons as well as all the physicians. When we study in the medical schools, we have the viva question on it, we have a theory question on it, and we can get a case, clinical case related to this. So this should be made clear once for all. Now, first of all, before learning what is the differences, we should understand the anatomy. We know that there are 31 spinal segments and we have two swellings in the cord. One swelling is for the upper limbs, that is the fibers which arise from the cervical spinal segment C1 to C8. There is a swelling at the cervical level and another swelling is present at the lumbar level. This swelling is the one from which the lumbar fibers they arise and for the lower limbs. Now first of all, you should know what is conus. What is conus medullaris? So this part after this swelling, there is a small part. This is terminal end of the spinal cord. Terminal end of the spinal cord, it is called conus. So what are the segments which are present in this terminal end? That is the sacral segments from S1 to S5. And we know that first question we always answer is where do the spinal cord end? The spinal cord, it ends at between L1 and L2. So what is the vertebral level of the spinal cord ending? It is between L1 and L2. So what is the vertebral level for conus medullaris? It is same, that is L1 and L2. But what is below this? Below this we don't have cord, we have the fibers arising from the lumbar segments and the sacral segment. All these fibers, L1, L2, L3, L4, L5, S1, S2, S3, S4, S5, all these fibers, they will make Cauda equina. Okay, so the first question, what is the vertebral difference at the vertebral level? The vertebral level of conus medullaris is L1, L2, and for the vertebral level of the Cauda equina, it is from L1 to S5. Then comes, what are the spinal level? What is the spinal level? The spinal level for the conus medullaris is, we know that this, what are various spinal segments which form it? It is the sacral spinal segments which form the conus, whereas the Cauda equina, it is made from the fibers from lumbar to sacral. So conus is sacral segments only and Cauda equina is the fibers which are arising from L1 to S5. Okay. Now, after making it clear, now we will learn about the differences between the conus medullaris. Now one thing more, we know that in conus there is a part of the spinal cord. If conus is affected, so it will be a myelopathy, whereas the Cauda equina, we have the roots only, we don't have the spinal cord, so it will cause a radiculopathy. Okay, so it will be radiculopathy. What type of lesion it will be? It will be LMN lesion, whereas the conus, it will be a UMN lesion at the level, and it will be LMN, and below it, it will be a UMN lesion. So it will be a myelopathy in conus and radiculopathy in Cauda equina. Okay, now we will learn about the differences between the conus medullaris and Cauda equina. First point, vertebral level. It is L1 to L2 for conus and below L2 to the sacrum, that is Cauda equina. Spinal level, what segments they form this conus medullaris is the sacral segments, and for Cauda equina, these are L1 to S5, that is lumbosacral fibers. Presentation, it will be, because conus, it is a myelopathy, so it will be, presentation will be sudden and it will be bilateral, whereas in Cauda equina mostly it is a gradual onset lesion and presentation is mainly asymmetrical. You should remember, for Cauda equina it is asymmetry, atrophy. Okay, so gradually and areflexia. 3 A's for Cauda equina is asymmetry, areflexia and atrophy. So it will be gradual and unilateral. Radicular pain, radicular presentation is with Cauda equina. It is more severe with the Cauda equina. Low backache with the Conus medullaris. Motor strength, we know that the lesion, it is symmetrical. It is less marked weakness, and it will be only present in the sacral segments, so it will be distal weakness of the foot, and there will be hyperreflexia. Whereas in the Cauda equina it is asymmetric, the weakness, because the fibers involved, these are L1 to S5, so more wide distribution, more marked weakness. And areflexic, we know that in the lower limb we do have two reflexes, knee and ankle. For the knee and the ankle, it will cause areflexia and there will be atrophy. For the reflexes, we know that what constitutes cauda conus medullaris, sacral segment. So knee, it is at the L3. Okay, so knee reflex will be present, ankle will be absent, whereas in Cauda equina both knee and ankle will be absent because the lumbar and lumbar to sacral fibers all are involved. Sensory distribution, it is bilateral saddle type anesthesia. In Conus medullaris it is asymmetrical, so it will be unilateral and asymmetry. Sphincter involvement, it will be early. We know that in the sacral segment S2, S3, S4, the sphincters, the control of the urinary bladder and rectum goes. So it will be, sphincter involvement will be early in Conus medullaris and it will be late in the Cauda equina. And impotence, it is frequent with the Conus medullaris and it will be less frequent with the Cauda equina. Thank you.
Hello friends, welcome to my channel Neurology Videos Learn by Seeing. If you are tuning to this channel first time, subscribe it to get the maximum neurology videos.